It is another interesting edition of your program of choice, Health Affair on AIT, a platform where we focus on public health issues, challenges of women and children with a view to providing lasting solutions. I am your regular anchor, Ushua Mowa Daniels. Our focus this week is on cerebral palsy. Let's take it to our new segment. We'll be right back. The Women's Voice and Leadership Nigeria project is a 5-year project funded by Global Affairs Canada to build capacity and support activities of local and national women's rights organizations. Implemented by ActionAid, the project in the last 5 years has impacted over 3.5 million individuals through various interventions relating to women's economic empowerment, sexual and gender-based violence, socio-economic inclusion for the elderly, women's political and leadership participation.
Today we celebrate the intersectional, impact that this project has had on different women and girls, their families and communities.
Yeah, it's not just enough to have policies or to think globally, but it's also to act locally. And that's what ActionAid and Global Affairs Canada in the Women Leadership Project have done in Nigeria, and especially in Lagos State.
To win the battle against sexual and gender-based violence, speakers called for the need to address socio-cultural and societal norms against women.
The idea is that where are the laws in place? Lagos State is big on zero tolerance to sexual-based violence. First and foremost, you need to be aware that there is a law and what the penalties are if you break the law. Then also, because we know that there are those that, irrespective of the law, will still perpetuate violence, they also are in touch with security agents who, once there is an incident, they call and they apprehend the perpetrators. There's also...
We've been able to touch the lives of 698,508 women and girls across 14 local government areas and 46 communities in Lagos State.
For them, any investment in women is investment in national development because it trickles down to the society. Nuclear medicine is a medical specialty that uses radioactive tracers to assess bodily functions, diagnose and treat disease. Specially designed cameras allow doctors to track the path of the radioactive tracers.
Because of his compassion for the sick and the vision that God gave to him, even though we're having amazing and impactful healing meetings, the Lord directed him to set up a hospital so that, well, not a hospital, to go into healthcare. Having this hospital in Nigeria, and particularly the nuclear medicine department, the direct vision of the man of God. And because of his commitment to excellence and exceptionalism, we understand that we have the only functional gamma camera in Nigeria at this moment.
The technology is innovative, it is cost effective, and it is free of side effects. That's the beautiful thing about it. It targets only damaged cells, or cells that are inflamed or cells that are mitotic. So it just goes to the local area where the problem is and deals with it.
Nuclear medicine is a game changer. It improves management. It shows good results. And we believe that our patients in Nigeria are going to be impacted.
Nuclear medicine can help you for a good diagnosis because in the radiology, normally you have only morphological information.
With the huge burden of cancer on Nigerian patients, the introduction of nuclear medicine by the Loveworld medical team will no doubt bring a positive interruption into medical care.
So now we are able to provide these services, and again, not just for radiosynevectomy, it's for prostate cancer, it's for various types of cancers.
Beyond cancer, nuclear medicine is also very effective for the treatment of arthritis.
A lot of Nigerians today, as they're getting to a certain age, there's a lot of development of arthritis. People that are obese are having leg problems because of the diet change in Africa now. Yeah. Many Africans are getting obese and are having this arthritis as they're getting to elderly age. So it is a game changer for arthritis.
This is both primary, a secondary, a tertiary center. All right? So it's a place where you can come to and you can get basically any kind of care. And like I said, the services have been, from beginning, terribly discounted. I can tell you that the rates that we are on till as at today are the rates that we were fixed in October last year, before the upheaval in the costs of living that we all have seen. Whatever it is that you are going to get outside this country, you can get it here.
The world-class medical facility at Oregun area of Lagos State, southwest Nigeria, offers a variety of healthcare services ranging from neurology, cardiology, fertility medicine, family medicine, and lots more. Every year, this group of medical lab scientists gather together to analyze prevailing health conditions across the country to arrive at a topic. For the year 2024, the alarming rate of prostate disorder, especially among middle-aged men, caught their interest.
Things are changing in terms of lifestyle modification. Our dietary our diet is also changing. The environment is changing, and then so in recent times we found out that middle-aged men do present with this prostate disorder, unlike it used to be before. That used to be an issue or a disease of the old.
You need more than a doctor. Sometimes we need to send samples to the laboratory or ask for radiological evaluation by ultrasound and other imaging studies to get complete information so that we can treat the patient properly.
Prostate cancer is the most common and second leading cause of death among men, with risk factors such as age, race, and family history.
There is need for us to escalate this discussion so that we can do a lot of awareness.
We should not wait until men have symptoms before we screen them. The symptoms of prostate enlargement are difficulty in passing urine, exerting pressure before urine comes out, or urine not coming out immediately, or unable to hold urine, or feeling that you have not emptied your bladder very well.
Empowering lab scientists to produce accurate, precise results is critical, and ensuring that there is that we're combating the proliferation of, I would say, fake labs or unauthorized labs across the country.
If detected early, prostate cancer is one of the cancers with 90% survival rate, according to experts. Humans, in the course of time, have achieved unprecedented progress on a number of key development issues, but these successes have not been without fault lines in current development models, posing numerous environmental, social, and economic threats to our way of life. This necessitated the Sustainable Development Goals framework, unanimously adopted by the United Nations member states in 2015, with a layout of 17 goals for the world to achieve by the year 2030. How to facilitate the achievement of these goals informed this gathering, Africa Social Impact Summit 2024.
How do we build more trains? How do we get more buses on the roads? How do we build better hospitals? How do we cyber protect ourselves? And so on and so forth. How do we connect as a people? Private sector, public sector, so that we can all work together to achieve this aim.
Everyone is realizing that silo execution can only take us so far. There is intentional action of working together, bringing down our differences and identifying areas of synergy to ensure that hard-to-reach communities, the vulnerable, the less privileged, are met at the point of their need.
The event, which is the third in its series, has seen over 40 partners working together towards the acceleration of SDG goals in Nigeria and the African continent.
So if there is one thing we hope for, is that we would reduce the wastages in the space for social impact, will increase the efficiency from the investment in social impact.
Attainment of the SDG goals by this set time, according to speakers here, will see an end to poverty, protection of the planet, and ensuring that all people enjoy peace and prosperity.
Like 2 or 3 days ago now, I'll be praying because I need the eyeglass. So I was so happy this morning when I heard that they are doing such a program.
Like Madam Omolara Saraki, many now resort to faith and prayers for divine intervention as far as healthcare is concerned. This no doubt accounts for for the large turnout of beneficiaries at this community health outreach in Onigbongbo community, Maryland area of Lagos State.
With the rate of inflation, with the high cost of living now, medical expenses are on the high side. Not everybody can actually afford medications. That is why Perfect Smile Health Initiative is coming out to our communities today to improve the health of people, to assist them.
We are having free malaria testing, free HIV screening, the BP check, the blood sugar check. We are also having hepatitis B vaccination and testing. We have the eye clinic where they will be giving free glasses and also eye drops for people that need it.
This is our own way of actually imparting into the community. And I want you to see Rotary as always a blessing to every community that we find ourselves.
I've done for the BP. We need more. They have to help us to do more. And God will strengthen them.
Apart from investment in preventive health care, speakers advised the community members to take advantage of the state health insurance scheme to reduce the burden of out-of-pocket payment for their health care needs.
A healthy population, people often say, builds a prosperous nation. But many Nigerians are threatened on a daily basis and die needlessly due to diseases, poor health care, malnutrition, and lack of access to relevant health information. The sorry state of our health infrastructure is also a major challenge. On Health Affair, Oshomo Daniels brings these challenges to the attention of relevant authorities for a lasting solution. For sponsorship and other placements, please call the numbers showing on your screen. Health Affair, your access to good health through relevant information.
Welcome back. Cerebral palsy, commonly known as CP, is a group of conditions that affects movement and posture. It is caused by damage that occurs to the developing brain.
Cerebral palsy is a developmental disorder. It's a physical manifestation of movement and posture disorder as a result of injury to an immature brain. This injury could happen either before the child was born, during labor, or after labor. Aside it being an injury, it can occur as a result of conditions affecting the mother while in pregnancy, such as maternal diabetes, a woman with hyperthyroidism, even ingestion of unprescribed medication, herbal concoctions, and things like that. Even maternal infection could affect the child's brain while it's still developing in the womb. Some genetic disorders too, even in the child, could manifest after delivery as cerebral palsy. Now, during labor, which is one of the commonest parts that we have in our environment, because cerebral palsy it happens all over the world, but the causes varies depending on location. In our environment, one of those the major parts that we see are those ones that occur due to poor management of labor. Some even in best centers where labors are being managed properly, they still come down with cerebral palsy. Among them are those children that have birth asphyxia. That's the ones that have difficulty breathing immediately after delivery. Those that have jaundice, that's jaundice at birth or immediately after birth. Those that have brain injury, traumatic brain injury after delivery. Those mothers that have premature rupture of membrane, infection during or even after labor, this causes injury to the brain. And as the child is growing, it tends to manifest. Initially, some of these things will not be seen after the child is delivered, but as the child is growing, that's why they call it a developmental disorder. As the child is growing, it will start manifesting clinically because the developmental milestones will be delayed, some will be absent. Among them are those like when the child is supposed to have a neck control. You know, when you lift the baby up at 6 weeks, 2 months, you expect the baby to be able to hold the head up. These children will not be able to do that. As at the time where they're supposed to have social smile, when they're supposed to sit, be able to sit with support or even without support, this will be delayed in these children. Some of them, even up to the age of 2, you see a child will not be able to sit. Some of them, when they're supposed to stand, they will not be able to stand. So these are the manifestations that happens once a child's brain has been injured. Though the injury is not progressive, But because the part of the brain controlling a particular function has been damaged when the child was still developing, this would not be manifesting as the child is growing, as the child is attaining more, growing older, the features will be coming up. Now, when different parts of the brain can be affected. So there's one we call global, and there's that we say is like localized. The global one can affect almost every part of the body, both the upper limb, that's the two hands and the two legs. Even their cognitive function can be affected. You see those children, when they walk, they'll have abnormal movement, they'll be dwelling saliva. Some can be lucky with it such that it will just affect a particular part of the body. It can be what we call hemiplegic cerebral palsy, just maybe the limb on one side of the body. It can be diplegic, it affects every part of the body, but it's usually more on the lower limbs. It can be paraplegic, just as it to be just the lower limb, the upper limb will be spared. So it has different manifestations. So those ones that have a localized manifestation, they have a better prognosis compared to the global ones. And the aim of management in these children, because the injury has happened to the brain, is not usually reversible. So the aim of management in these children is to get them to independence. So it's multidisciplinary. At the early stage, we try to do more physiotherapy, occupational therapy, and speech therapy, because some of them will still not be able to talk when they are supposed to. So the physiotherapy mainly is to help them gain control of their muscles. They will also help them in terms of posture. Occupational therapists help them in fine movement, how to be able to do things independently, not their buttons, and to be able to carry out activities of daily living with minimal or no support. Because of the speech difficulty, the speech therapists will also help them in terms of phonation. Even at times, they teach them how to use a sign function. So aside this, some of them will need medications to help them with because they have muscle spasticity, so they will need medication for muscle relaxation. So we give them baclofen, dantrolene, and the likes. Some we may even need to inject them with botulinum toxins to help them relax the muscles. And when for those that need botulinum toxins, usually done is a theater procedure, which will be done under a form of anesthesia. And the botulinum toxin help them to get a better muscle function over a longer period of time compared to the oral medications they use. It's something that happens all over the world. But in our own environment here, the major challenge we have has to do with the poor maternal care during pregnancy. So it's something that is very common. It's all over. And still, so long we still have the poor birth attendants carrying out their activities in the outside the hospital, we still have a good number of them coming to the hospital. Some of them, they don't come to the hospital. In some rural environment, in some rural areas, what they do is once they see a child with such difficulty, they just send them to a grandmother to go and take care of the child. When I say take care of the child, they eliminate those children without even letting them come to the hospital. So it's something that is very common. I have a school here where some of them are being taken care of, and eventually they get to marry each other. It's not something that can be transmitted, except if the cause has to do with the genetic problem that's affected the brain. But such people can have normal children on their own, because it's not something that can be transmitted. It's not transmissible. It was an injury that happened to the brain. Just like somebody who had a fracture. Fracture is not transmissible. It can be a challenge, because for a mother that has a child with a global affectation, that's the one that's affected the whole body, that child may be dependent for the rest of his life or her life. So it can be a problem, it can really be a burden. But for those ones that have localized affectation, maybe affect one part of the body and the other part are spared, many of them tend to get to independence and they'll be able to live their life, though they may not be to live a perfectly normal life. That is the challenge. So these are a group of people that need support. Stigmatizing them does not help anybody. Going close to them does not make this thing to be transmitted to anyone. It does not affect. It's not like an infection that can spread. So it doesn't affect people supporting them. Yeah, it's so unfortunate that somebody is having a challenge, and then for the person to be supported in our environment, we stigmatize them with funny beliefs. It's so unfortunate, but such person needs help not to be stigmatized, because it's something that can happen to anybody. In advanced world, one of the major causes because they tend to help challenge children to survive. Maybe those children that have genetic disorder affecting their brain development, they still find a way to make them survive. So those children will still come down with features of cerebral palsy. So they have it even there, where they don't do blood money rituals. So how do we explain that? So in our own environment, a mother who had labor challenge, maybe a prolonged labor, eventually the child came out with cerebral palsy. How would that relate to money rituals? It's a challenge that can happen to anybody. Here in this hospital, we have a school for such children. They have a school where they, as in special school for them. They educate them, they train them on how to become independent, and many of them go to that level. So, directing them to the right place. But they have many. There's another school as such in Oshodi where they can also go for such training as well. So I believe in some different parts of the country where we have orthopedic centers, these people can get necessary help they need there. So directing them there will be a good way of supporting them.
I work for USAID-funded Breakthrough Action Nigerian project, and I'm asking you to watch Health Affair because it is an authentic platform for health information.
If you are just joining us, it's Health Affair on AIT, and next on the program is a nutrition segment. That aspect of the program that focuses on eating right to stay healthy.
Carrot is a root vegetable, usually orange in color, though white, purple, and other varieties of colors do exist. People have been eating carrots for over 5,000 years. The plant, according to researchers, originated in the Middle East and Afghanistan. Carrots was originally cultivated for its leaves and seeds. Carrot is a nutrient-dense root rich in antioxidants, fiber, beta-carotene, other vitamins and minerals. Consumption of carrots is good for vision, promotes hair growth, weight loss, regulates blood pressure, lowers cholesterol levels, and helps eliminate toxins from the liver.
On our clinical segment, we give you tips for healthy living.
How to care for the heart. What should people take? What should they not? Can you tell us some of these things?
Well, heart disease, what can you do to limit your chances of getting heart disease? And this affects everybody. Unhealthy diet is number one. And a diet that is unhealthy, a diet that contains too much salt. Salt is a dangerous chemical which is available in most food, and especially in tin foods. Diet that contains too much trans fat. There's a form of fat in the diet which we call trans fat. Damages the heart.
We appreciate your contributions on our perception segment on how to improve human lives and state of the nation.
Our scheme is supposed to be compulsory. In fact, it's compulsory. People wondering why we're making it compulsory. There is no country in this world that's running a voluntary scheme that has been successful. And the simple analogy is when government says, insure your car, everybody runs up and down. Because if the police stops you and you don't have an car insurance, you're in trouble. But when they say insure your health, everybody is looking at, why not? So which one is better, your life or your car?
This I will wrap it up this week. Thanks for spending your time with us. Let's do it again same time next week. And please don't forget to advertise your health product and services on the program. I remain yours truly, Usho Mowa Daniels. Please keep staying safe.